Hi, welcome to Heal Thyself. This week's episode is continuing on vagus nerve stimulation, focusing on concussion and TBI therapies. Hi, I'm Lily Woods. I've spent the last 20 years educating myself on many holistic modalities and applying the lens of my education in neuroscience, neuropsychological assessment, and quantum science to many of those modalities. My goal is to help you gain knowledge on these topics so you have a broad perspective on the different modalities out there, and you can take control then of your own wellness journey like I have. In a study by Lager et al., it was found that 1.3 million people were diagnosed with concussion in 2008 through 2016. The annual average was 148,000, and 79% of those were diagnosed in the emergency department. The average annual incidence was 1,153 people per every 100,000 residents. The incidence varies by sex, age, geography. Children younger than 5 years had the highest incidence of a concussion, more than 3,600 per 100,000 individuals in that particular age group. Males have a higher incidence than females, except in the older than 65 years age groups, adults. There's a Pearson correlation 0.669 between sustaining a concussion and living in rural areas. A concussion is a type of traumatic brain injury, or TBI. It's caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to rapidly move back and forth. This sudden movement can cause the brain to bounce or twist in the skull and create chemical changes in the brain, and sometimes stretching and damaging the brain cells. Damage occurs in a TBI to the autonomic nervous system, the ANS, which has sympathetic and parasympathetic aspects. In a medical setting, monitoring of the ANS happens after any type of TBI. When an injury occurs, cytokines are released into your system, which causes inflammation where the injury occurred. This swelling causes numerous symptoms in concussion, as well as damage to the vagus nerve itself. The damage causes your immune system to kick in and send cytokines to the area to assist with healing. Cytokines in the brain cause inflammation. In the tight constraints of the brain, the inflammation can cause even more damage. Rest can help your body flush the inflammation, but many times it does not flush it out effectively, and the inflammation actually causes more damage. There are short-term and long-term implications in concussion, and research suggests that even a single knock to the head can have severe consequences later in life. For example, figures from one study analyzed more than 160,000 trauma patients and identified that in patients aged 65 and older, just one concussion was associated with a 22 to 26% increase in the risk of dementia in the following 5 to 7 years. Even clearer is the research showing the neurological damage accumulating with multiple knocks to the head. Even when you're apparently symptomless or subconcussive, repeated concussion has been linked to increased risk of neurodegenerative conditions like Alzheimer's, Parkinson's, as well as chronic traumatic encephalopathy. CTE is a progressive disease with Alzheimer's-like symptoms. It was first discovered by a neuropathologist, Dr. Bennett Omala, in the early 2000s in the brain of Mike Webster, a former National Football League player. Data from the studies of former elite athletes is staggering. A survey of more than 2,000 retired professional players found that those with a history of multiple concussions were 3 times more likely to have been diagnosed with clinical depression. Another study of death certificates found that the death rate from neurodegenerative diseases was 3 times higher for pro footballers than the general population. So let's talk about damage to the autonomic nervous system. The symptoms of that are lightheadedness, headaches, poor focus and concentration, slowed reflexes, increased anxiety, low blood sugar, and chronic fatigue. Trauma causes metabolic inflammation in the areas of that injury. When the cytokines and chemicals produced by the immune system flood that area, it causes inflammation, and it causes a domino effect through the other systems. A reaction occurs to a wide range of cells in your body, and the dysfunction prevents healing to occur to the damaged site, while also adding to the autonomic damage. This can also cause arthritis, joint pain, and poor wound healing. When the inflammation is lowered, then the brain can get the repair it needs. So the sympathetic and parasympathetic systems of the autonomic nerve system are touched a lot by the vagus nerve. You can see the multitudes of systems, conditions, automatic responses that this system is implicated in. Any one of these channels can get damaged, even with a concussion. It can stretch or nick or constrict the vagus nerve in these areas, preventing those electrical signals from getting through. The vagus nerve communicates with the components of the lymphatic system as well. The liver, the spleen, the small intestine, the lymph nodes. All of those systems have the responsibility to remove the fluids and dead cells from the body. The tragus on the ear can be stimulated with a small current from an electrode attached to the ear, which is called auricular stimulation. It then travels down and accesses the organs where communication channels have not been operating effectively. Those systems then kick back in to reduce that chronic inflammation. So when you're measuring this out of a clinical setting, there's a lot of different techniques that you can use. Stimulation therapy to reduce the state of the body's inflammation and to increase ANS function are the two different measurements that we're trying to do to make sure that we're achieving what we want to in the therapy. HRV testing, heart rate variability, is measured with a pre-measurement and then a post-measurement. You can do this with different tools. You can also do it with a breathing test. The time is measured between the recovery of the heart to normal after holding a breath, and the HRV has been researched and proven to measure ANS as effectively outside of a medical setting as it would at your doctor's office. Digital thermography has also been used many times to look at the reduction in inflammation. You'll see in the pictures in the red and orange areas of this digital thermography that there's a lot of inflammation and clogging in the systems of this picture. And the bottom, you can see where that clogging has been released, the fluids have been removed, and the inflammation has been lessened. So using those two techniques, you can measure the progress and if the therapy is doing what we want it to be doing. So the different tools you can use for vagus nerve stimulation depends on the conditions that you have and what we're trying to accomplish. So when you stimulate through transcutaneous routes, which is called TVNS, you need a high quality electrical stimulation device. The surface electrodes are applied either to the tragus, which is outside the ear, to the anterior, the posterior, or the inferior walls of the ear canal, and to the cymba concha, which is connected to one of the many points of transcutaneous electrical nerve stimulation, a TENS machine. So by using these different entry points where the vagus nerve can be stimulated, because it's also right, it has an entry point because the vagus nerve is right there. We also perform the stimulation using alpha frequencies at 50 hertz or 100 hertz, which has been proven to be most effective. This stimulation has been shown to help alleviate the symptoms of concussion and TBI in multiple research studies. We provide this at Body Harmonics, as well as providing multitudes of other modalities that work together to reduce that inflammation, to get your system moving, and to make sure that the vagus nerve is operating appropriately. Look forward to next week when we're talking about other modalities that might help you. Thanks for joining me today with Heal Thyself, talking about concussion and TBI. Thanks for joining us today. I would like you to like, subscribe, and share my channel so other people can get this education as well.